Hi, good day to all of you. Thank you for joining the discussions on vascular event at ophthalmology. So this slide summarizes most of the important vascular event in the ophthalmology based on the presentations. Okay, so the keyword here is a sudden and also acute onset of the ischemic event, which are quite well known for most of you, the CIAO and also the AION. So because of this, this is a sudden onset of the event that presented quite classical that they come to you after a few hours of the presentations or even one day after the onset of the symptoms. Okay, hemorrhagic, it will be another sudden and acute event as well. For example, the between hemorrhage and also the hyphema. So they will come to you also after 1 or 2 days. Okay. The other thing that had to bear in mind is ischemic or hemorrhagic event can have a gradual onset or asymptomatic. The classical example will be ischemic retinopathy due to a diabetic retinopathy. You know that most of the time they can be asymptomatic. Yeah, the other thing, ocular ischemic syndrome. Yeah, so even though they affect the major vessel, but because of the collaterals and other reasons, their presentation usually is a chronic and gradual, even though they are also considered ischemic. Okay, the other classical one will be cerebral venous thrombosis. Yeah, the symptoms depend on the various locations. The most important thing in this discussion is we look for the similarity in all these disease processes. For example, their presentation as stated in this slide, and also the pathogenesis, the risk factor, the workup, and also the treatment as well. When to suspect vascular event? First of all, from the history, we should know that, as mentioned just now, usually they happen acutely and also suddenly. So they can have a sudden blurring of visions due to CIO, sudden scotoma, and also visual field loss due to the PIAO and also the AION. And also they can have a sudden double visions because of the ischemic mononeuropathy. The other thing to identify in the history is whether this is the first episode or not. Okay, most of them they have the risk factor in their vascular system that lead to this problem, so they can possibly have a previous attack which can be a milder or even more severe attack before this. So this recurrency of the similar symptoms will tell you, this can be a vascular event as well. The most important from your history and also the examination is look for the risk factor. One thing for you to diagnose the disease, the other thing is to modify the risk factor so that we're able to reduce the recurrency of the disease. Okay, most of the vascular events are painless because they are usually involve the problem in the blood vessels. This is, for example, thromboembolic. Okay, but be careful of the painful vascular event, which is more important for us to identify because there's a component of the inflammation and even the infection for us to treat. Okay, so a classical example will be those vasculitis, either due to the infections or also the inflammations. Yeah, this slide is just for me to rephrase again regarding the sudden onset of the visual complaint. Yeah, it's a generalized blurring of visions. You need to suspect something in your retina, in the CIAO. Yeah, something happened in the scotoma, I think in the center, it can be a submacular hemorrhage that can happen. Yeah, the other thing of the visual field defect is something that you all should well aware due to the visual pathway, due to the cerebrovascular event, either it's a hemorrhage or ischemic stroke. So patient can suddenly present with the sudden onset of the loss of the visual field. And the classical altitudinal visual field defect in the ischemic optic neuropathy. The other thing is don't forget the double visions due to the sudden vascular event that affect the motility of your eye movement. Yeah, this is should be a familiar slide regarding the blood supply to your ocular structures and also your visual pathway. The important principle that I would like to highlight here is regarding the end artery and also the presence of anastomosis in certain arteries. So for those who has an artery, for example, a central retinal artery, and also your posterior ciliary artery, yeah, that supply your retina and also part of your optic nerve head. So any small occlusion that happen in this end artery that can have a major effect, and the presentation will be very sudden, and also they usually have quite a significant symptoms. Okay, as compared with those vessels that can have anastomosis, for example, of your anterior segment and even your iris, they have quite a good anastomosis of the vessels. Okay, so in these kind of cases, then only have a very significant ischemic event that affect most of the vessels, then only the effect will set in. Okay, the other thing also is regarding the big vessels. Okay, so for example, of your ophthalmic artery, the vessel itself is big. So usually for the stenosis to happen, usually unlikely that he can have very sudden onset of the symptoms, okay, as compared to a small end artery. That's why ophthalmic ischemic, ocular ischemic event that usually gradual and also chronic because of the stenosis. However, that any single small little obstructions happen in the end artery of the central retinal artery, the effect will be very sudden and also very remarkable. Okay, this slide we are discussing regarding the relationship of the blood supply and also the symptoms and also the disease that it can cause. So, the obstruction in the carotid and ophthalmic artery will lead to ocular ischemic syndrome, which is usually gradual and chronic. Central retinal artery will lead to CIAO or BIAO. Further down, the retinal arterioles and also the capillary will lead to something like classical called the blue spot or subtle retinal depression or atrophy, then which can most of the time is an asymptomatic finding. The other retinal capillary occlusions that happen in the macula will lead to something called a paracentral acute middle maculopathy. Yeah, as we mentioned, we won't discuss every single disease in details here, but for you to understand that all these diseases are under the same group of the vascular event. So ciliary artery will supply your optic nerve head and also your choroid and also your outer retina. Any occlusion of this ciliary artery can lead to the ischemic optic neuropathy. Yeah, and also the other thing is they can have a serial retinal artery occlusions, which is quite a so-called as an atypical example of the retinal artery occlusions. The other thing also is some more rare event of a choroidal ischemia. The blood vessel that supply your visual pathway and also your cranial nerve in your brainstem and also the cerebral cortex. Any occlusions of it, usually called as one part of the cerebrovascular event, or also can lead to inflammation. Can also lead to the visual pathway and also cranial nerve disorder. The other thing that when you suspect there is a vascular event, especially ischemic event that happen, you always look at the involvement of whether this is an inner or outer retina. As you all should know, there is always a watershed zone over the outer and inner retina that's supplied by different vessels. Okay, optic disc is the same as well, whether this optic nerve involvement is in the posterior or anterior, and whether it's the upper half or lower half of your visual field that affect. Okay, and also whether anterior segment is involved or not, for example in the ocular ischemic syndrome. Okay, so because of this, as we mentioned, the end artery usually is a very small artery and also they supply quite a particular area. Okay, so most of the time when you have an end artery occlusions, usually their vision will not be super bad. Okay, for example of your ischemic optic neuropathy, most of the time they affect half of your visual field. Same thing as well for your central retinal artery occlusion and also your ciliary artery occlusions, because they supply either inner or outer of the retina. So in the cases that very bad visions that you suspect there is a retina ischemia, there must be both ciliary and central retinal artery occlusions, or possible this is an ophthalmic artery with the ophthalmic ischemic syndromes. Okay, but usually, as mentioned, the presentation most of the time should be a chronic and gradual and not sudden onset like in your ciliary retina and also central retinal artery occlusions. Okay, this is actually the most important slide that I hope you all can remember. Okay, so basically this slide will illustrate basically the pathogenesis, the risk factor, and also the workup that you should carry out when you suspect a vascular event, whether this is vascular event involving your artery or even the vascular event involving your vein as well. Okay, so I think you all should know this. What triad is this? This is a Virchow triads. Okay, so involving the presence of either the stasis, vessel wall injury, and also the hypercoagulability that lead to the thrombosis event of the vessels. Okay, this apply to both the artery and also the vein. Okay, but the example of whether stasis or vessel wall injury and hypercoagulability is slightly different between your artery and also your vein. Okay, so you still need to differentiate first of all whether this artery or vein. After that, then only you need to narrow down the possible etiology based on these triads and also the workup that you need to do. The classical example is in the vein occlusions. Most of the time we are not looking for a so-called a thromboembolic event. Okay, because embola I can say you will never ever able to go through from your artery, go to your capillary, and then go to your vein. Embolic event most of the time you only affect your artery. Okay, but how about arteriosclerosis? Arteriosclerosis also most of the time should affect on your artery. Okay, but certain vein occlusions, the classical example is a central retina vein occlusions, and also even a branch retina and vein occlusions. You need to look for the risk factor of arteriosclerosis, because the arteriosclerosis of the artery of your retina is the one that causing the compressions over the vein. Okay, so these are the example that make it into overlap, but it's still following the triads or the Virchow triads. Okay, so some other people will like to classify the risk factors, okay, according to the whether it's a intraluminal, okay, intramural, or extraluminal or mural as well. Okay, most of the time this is usually for all the tubular structures. Okay, it can apply for the vessel as well, especially for your center, especially for your local causes. You have a tumor that causing the vessel obstructions. Okay, why not? It can happen as well. So the other way to classify the factor is whether this is inflammations or infections, whether there is associated with the pain. That's why pain is quite important in the vascular event. Okay, never forget to ask the history regarding whether it's a painless or also painful event. Okay, so the other way to differentiate the causes is whether it's a local and also the systemic. Okay, what we always talk about here is usually is a systemic event, because very important to identify the systemic risk factor for to control it. Okay, local risk factor is really depends on the locations. In the retina, it can be a retina detachments. Okay, so retina vasculitis that happen this one. Okay, the other local event that can happen in your carotid artery can be some tumor, your cerebral, your carotid sinus can also because of most commonly because of infections that lead to thrombosis. Okay, they are the so-called the local event. Okay, but very important thing is we have to know that the systemic associations, because the workup should be directed to that. The local event, most of the time you're able to see it, or you're able to so-called to using imaging to visualize it. Okay, in continuation of the previous slide, we are going to show you an extensive but not exhaustive list of the risk factor. The most easier ways is to remember this Virchow triad. Okay, so under each of these category, then you give some example according to the disease that you are dealing with. Okay, so for arteriosclerosis, due to the age, metabolic disease, smoking, and homocystinemia. Okay, so this will cause the endothelial injury by the arteriosclerosis. Homocystinemia itself actually causing the hypercoagulability. And also the stasis as well. Okay, thromboembolic event, as I mentioned to you, is very particular. We apply to the artery disease. Okay, so the sources can be various causes. Yeah, we are not going one by one. Okay, so all the other causes of the hypercoagulability. Okay, this is I think this is quite a standard. Okay, yeah. For me, I think that is very important for you to remember. Okay, at least 2 or 3 examples under each category. Okay, so and also important thing also, we don't throw all these risk factor to apply for all the cases. Okay, so the important thing to differentiate is one thing is, as mentioned, based on the history, whether this is a painful event or not, then it can suggest of inflammations and also the infections. The other thing is based on the character of the patients, whether you're dealing with an old patient with all the comorbid that you're actually able to identify just from the history, like they have all the metabolic diseases, or you are dealing with a very young patients that already have a workup for the simple atherosclerotic event, they have no non-medical illness, then you know that your target should go to all the autoimmune disease, and also even some of the malignancy that lead to the hypercoagulability and also hyperviscosity.